The other thing I wanted to discuss here with you today is this whole concept of coronary calcification scoring, this nice and detailed assessment of the coronary arteries to assess, your risk of cardiovascular disease downstream. I mean, I think that you're quite pioneering in thinking about how to use this for patients who are cancer survivors, right? So tell us a little bit about that.
We don't want our patients, once they've gone through their cancer treatment, to fundamentally develop a life-threatening illness again. If we can find strategies for early detection and early intervention, and if we think that they're at higher risk of these issues, then what we can think about is personalized strategies to do these screening tests in this particular population. So we've looked at this in our group, looked at using coronary artery calcium as a measure for who's at higher risk than the general population. The reason why we have to think about the cancer patient and the cancer survivor differently is because their risk is different than the general population. So different screening approaches, different screening strategies have to be a part of it. So while you may not think about coronary artery calcium for everybody, but for certain high-risk individuals, I think it's really, really important. And I'll give you an example. So radiation therapy is something that we have successfully used for the treatment of many cancers. But radiation therapy has major effects on the arteries and the coronaries, especially if it's given to the chest. And in fact, patients who have radiation therapy as part of their cancer treatment need to be very closely monitored. So coronary artery calcium may be one way in which you can actually monitor for plaque buildup and actually set the stage for early interventions like lowering cholesterol, better blood sugar control, and blood pressure management, etc.